spoke was?
Hyoscyamus.
Did we finish Hyoscyamus?
No.
What do you remember in Hyoscyamus? A quick revision. Adult is what is left over. We'll take up adult today, and if time permits, we'll also try to finish off the adult of Hyoscyamus. But before we take up adult, see, to understand the mind of adult or the adult Hyoscyamus, I've already tried to tell you about Hyos side and discuss the ailments from characteristic symptoms and particular symptoms. The only leftover part in Hyoscyamus is adult. Okay. Now, can you think of, or can you start contributing how exactly a Hyoscyamus adult will be? Very good, shameless. Straight away, first point, shameless. Good. Other than shameless, what else?
He is jealous.
Very good, is jealous, yes. Suspicious, violent,
Delusions.
good. He's got plenty of delusions. Intelligent, yes, good, yes.
Fear of being poisoned.
Hyos is intelligent. But what was the nature of intelligence
For
we were
bad way.
He is intelligent, but that intelligence is not used for good things. Okay?
Talks obscene.
Talks obscene.
Fear of being
very
poisoned.
abusive. Fear of
Being poisoned.
being poisoned, good.
Talks to the invisible persons.
Talks to the invisible person. I mean, the adult is done. What is left over?
The double meaning.
Yeah, he talks more in double meaning. That's the only thing that is left over. Okay, chalo, what else?
Exhibition.
Exhibitionism. I mean, I don't know why we had a feeling we have not covered Hyos adult.
Quarrels.
Yeah, quarrelsome. Yes, they are quarrelsome. What else?
Makes faces.
I mean, yeah, child, or for that matter, even an adult, they can make faces, okay? And they are very attention-seeking patients, okay? See, don't worry. Like what we did is Harmonium, we'll try to understand the mind of Hyos under two very important headings. One is that they have very strong emotions. We'll take up that part. And before we talk of emotions, there's a very important area that you need to address, and that is the sexual sphere. That is the sexual sphere. Now, what under mind will come under the sexual sphere? What under mind will come under the sexuality? Increased sexual desire. Yes?
Nymphomania.
Yeah, nymphomania. Nymphomania, good. There is nymphomania in Hyos. One of the top remedies for nymphomania. Increased sexual desire in both sexes. Not necessarily women. Even men have increased sexual desire. And we call it as satyriasis. Satyriasis. Okay. Hyos is also lascivious. Hyos is amorous. A lot of things. We'll just try to take one by one. Now the first word that should come to your mind when I talk of Hyos mind, and especially the sexuality, what is that first word that should come? Somebody spoke already. When we, more than, I mean, why do they exhibit? What is exhibitionism? What is exhibitionism? Showing off what? See, showing off is not exhibitionism. Showing off can be a dress. Okay? Showing off could be a jewelry. Showing off could be your mobile. Showing off could be your marks. It could be anything. Okay? Now, what is Hyoscyamus trying to show off? Show off his private parts. Okay? And if you look into the old repertories, the only remedy which is described under the word, under the rubric exhibitionism is Hyoscyamus. The only 3-mark remedy which is shown is Hyoscyamus. Now, what is exhibitionism? Now that you have contributed, why do a person exhibit his part? Why do a person exhibit his part? Or his private part? Okay. So now here the intention is for sexual stimulation. The intention is sexual stimulation. So what you see in Hyos is like, first thing what you see here is they're very shameless people. They are very, very shameless. Okay. Now what are they shameless about? What are they shameless about? Shamelessness could be in terms of dressing, and shamelessness could be in terms of talking. Okay. And Hyos is very bindas. He will not bother what is the kind of situation I am in, who are all next to me, is it a girl, is it a boy, is it an elderly person, my mother, my sister, my brother, my daughter, my son. He is not bothered. When it comes to talking, he can talk whatever he feels like talking. And as one of your friends was trying to tell, the content, what they talk in Hyos is also very important. It is majority of the times, Hyos content is more of sexual content. Okay, so shamelessness, then I'll just try to tell you what exactly I mean by shamelessness. And it is marked by bold lack of shame. The other remedies you should know. Is are phosphorus, stramonium, sickle, barat and before. These are all the other remedies which are shameless. Okay. Any remedy you would like to comment? Anything? Any remedy that is over? Stramonium is over. See, stramonium reminds me of a small case which I discussed last class. You remember that case of we discussed a case, no? Boys, case in the last class. No, that was child playing with his testicles, handle, genital. Yeah, good, that's one thing. But I shared a case and I told you I'll share the follow-up, good or bad, whatever it is I'll share. What was the case? A man walking naked. No. That was an example I gave you about one of a homeopath's father who was very shamelessly behaving at home. He would walk naked or walk inappropriately dressed. Naked may not be 100% naked, but then again, not the way you expect a fatherly figure to walk at home. Okay, but that was a different case. Very good. Old man what? Correct. Want to be? Very good. Good. Wants to be kissed by his wife. But what was the basic complaint for which they had come to me? It was a case of Alzheimer's. It is a case of Alzheimer's disease referred by one of my colleagues from Coimbatore. Okay, patient is in Bangalore, and this is a beautiful case. Almost 15 days, none of the family members have slept. Very nights he becomes very violent. He continuously keeps talking. He will go disturb his daughter, his son-in-law, his grandchild, his wife. None of them are at peace. Almost so many days they have not slept. And they were also planning to shift this particular gentleman to an old home. Okay? But daughter was feeling a little senti. Sir, they went to two old age homes, they saw, and daughter felt very pathetic looking at the condition of the old age home, and she said, no sir, you do what you want to do, I am not putting my father there. Fine? Very lucky to have a daughter like her. So, she said, no, I am not putting, let whatever come, let whatever happen, I am not putting my father in that old age home. Okay? So what was the case? He was very violent, he was non-stop talking, and then as one of your friends rightly says, at least I am happy I told the symptoms so that at least one remembered, if not all of you. Fine? The purpose of sharing cases is you get connected. And what we are trying to tell you theoretically, when we apply that in our clinics and we share the results, good or bad, not necessarily every time the results will be good. And when are the results bad? When in case of Hyoscyamus we give stramonium, and for case of stramonium we give barat, and then the results will not be good, then the results will be bad. Okay. So this gentleman had again a funny behavior. The daughter was trying to tell us is he wants his mother, only mother, meaning his wife, to kiss him, which was a very unusual behavior found by his family members. Never he has done, sir, but now he wants my mother to always kiss him, and you are my wife, you should sleep with me only. Fine. They have kept one help, and that help, that boy, so he keeps fighting with him, he keeps troubling him a lot. Now the beauty is, we had the second follow-up. First follow-up was okay, after 15 days. And the second follow-up is what wife called, meaning the mother called, because daughter has gone abroad for work. So this lady called and she says, sir, 80% is better, we are all very happy, we are sleeping, he is sleeping, the entire house is at peace. Okay? Now the only thing he keeps talking is, he says, have you changed my diaper? He is on those diapers. So have you changed my diaper is what, are the diapers there is what, the only question he keeps asking. Otherwise he is very calm, he is sleeping, he is eating, he is moving around. Otherwise midnight he used to open the door and used to run away, or midnight he used to on the stove, I want milk, I want this, that and all. They have to keep the kitchen locked, they have to keep the house locked. Just bega kitkontirane. You have the video of the daughter telling the entire case, because it is getting recorded, I can't show you the video. Out of interest, anybody, I got plenty, I'll have to just cut it out, you can have a look a little later. So the remedy that was given was stramonium, which we did in the last class. Stramonium tenem. Why tenem? The rubrics, out of interest, I don't know, third years how much it matters, but then the rubrics were taken was delirium, violent, delirium, loquacious, non-stop he was talking, on and on and on, and very difficult to control him, and ultimately that wants to be kissed. The only remedy we have which covers the entire thing was stramonium, and after stramonium he is doing good. Okay, so we'll come back. So wherever we have applied the theory in practice, I'll definitely share the cases so that you feel yes, it's going to work. Okay. So one remedy that should come to your mind when you see a person who is shamelessly dressed. Now, what do you mean by shamelessly dressed? Girls, boys, what do you mean? When do you say shamelessly dressed? When you see too much of exposure. When you see too much of exposure. Fine? I mean, if you just, I don't know, I can't tell all this, but then at least after my class you will start realizing the Hyos heroines, the Hyos heroes, or the Hyos aunt, the Hyos uncle, or the Hyos neighbor, whatever. So what you have to understand is a very shamelessly dressing people. Fine? In the name of fashion, people expose too much. Fine? So there, that is also shamelessness. Yes or no? That is also shamelessness. Talking. See, when you talk, you should be aware of your surrounding. Who are you? What are you talking? All that you should be aware. You are not aware, and you are cracking all faltu jokes, double meaning jokes, irrespective of who it is, irrespective of you being comfortable or not. Hyos enjoys talking all that stuff. So that is Hyoscyamus. Shamelessness can be in terms of talking and dressing. And I also want you people to understand, this shamelessness in Hyos, that is not working well. See, shamelessness also applies to uncovering the sexual parts. Or what parts should not be exposed, that part, Hyos, is very comfortable in exposing. Okay? So, wants to be naked, again, a very important remedy that should come to your mind, especially in these states, like Alzheimer's, fine, or in insanity, okay, done in delusions, delirium, they walk naked. And one reason what Hyos can also give you is, for them, the dress is very, very sensitive, fine. The skin is hypersensitive, and that is one reason why Hyos may avoid wearing dress. Wants to be naked, shameless, uncovers parts, All these things is what you have to remember. Okay. Continuing further. Now this is what one of your friends was trying to tell us: lasciviousness. Okay. Huh? Exciting sexual desire. Fine. Exciting sexual desire, lasciviousness. So that's what we also saw under shamelessness. They wear dress so that it provokes the other person, the opposite sex. It provokes. See, who are the people, now small interaction, who are the people who wear such dress? Think of Hyoscyamus. What are the other symptoms of Hyoscyamus that will come to your mind? A lady, forget about it, a lady wearing dress which is not decent enough. What rubrics, what symptoms will come to your mind? The first thing is she's shameless, good. Very good, very good. Don't you think so? Majority of the girls, with due respect, because it is their constitution, we respect Hyoscyamus. Boys will feel bad. So with due respect to Hyoscyamus, what one of your friends is trying to tell you is, who are the girls who dress indecently are girls who want attention. And we also saw in Hyoscyamus that Hyoscyamus is a patient who needs a lot of attention. At the level of child, you saw, child will be disturbing you or disturbing your conversation so that he wants attention. As a grown-up girl, what is she trying to do is, she wants attention of the people in the function, she wants to be center of attraction, and what will she do? She's a very intelligent female. She knows how to attract. So, you understand? So, attention seeking and dressing inappropriately, dressing obscenely can also be Hyoscyamus. Any confusion? Okay. But see, based on dress, you can decide constitutions. Okay. There are people who dress very clean, very neat. Who are they? Arsenic. Very neat, very clean. I got a friend of mine. See, I keep doing this a number of times, and in the bargain, this all gets crumpled. Okay. So I'm not Arsenic Amar. I'm okay. Fine. I got a friend of mine, who even a small crumple over his shirt, he will not like it. Fine? He will not like it. Meaning, many times he's got extra pair of shirts keeping in his bag, and you see him changing and all. Very, abnormally fastidious. And that is Arsenic Amar. Arsenic Amar, Carcinosin, they dress very neat. Netramure. Is Netramure over? For RS4, it is over. Why Netramure is clean and neat? You want this or we'll continue with Hyos?
We want it.
Yeah, Map, at least you told you. Yeah, tell me. Why Netramure is particular about things being clean and neat? RS4, it's over. RS3 are in safe zone. Yeah, RS4. Netram, what is Netram? Don't tell me salt. Yeah, I know it is salt, but then what is Netram? Netram mind. Tell something at least. Okay, they have got fear of getting disease. Good. It's not the right answer. It will not make any difference. Don't worry. Chalo. See, who are people who are worried? See, yesterday there was this case. My wife had called me. There is this small girl, 6 years old girl, who has developed this bad habit of washing. Habit of washing. And for her, she feels the fingers are always dirty. And you see her washing. She touches the sofa, she goes and she keeps washing. And even school, it's become a problem. Before writing, she feels her fingers are dirty. Ma'am, excuse me. She goes, she washes, and then she comes and writes. 6 years old girl. Normal, abnormal?
Abnormal.
Right? You getting my point? Now what remedies come to your mind? Very good, Cyclinum. That's the remedy I told my wife, but then she took the entire case and she reported and she gave her phosphorus. Phosphorus also has this. Okay? So, fear of disease is something different. And what was that girl feeling? She was feeling dirty. I asked her, why is she washing? ಇಟ್ಸ್ ಪೆಕ್ಯುಲರ್. ಎಷ್ಟೋ ಸತಿ ನಾವು ಏನಾನೋ ಮಾಡಿರ್ತೀವಿ, ಕೈ ತೊಡ್ದಿರಲ್ಲ ಅಲ್ಲ, ಕರೆಕ್ಟ್. ಹೂ ಆರ್ ದೇ ಸಲ್ಫರ್ಸ್ ದೇ ಈಟ್ ಆ್ಯಂಡ್ ಏನೋ ಯಾರ್ದೋ ದುಪ್ಪಟ್ಟ, ಯಾರ್ದೋ ಎಪ್ರಾನು, ಅಥವಾ ಅವ್ರದೇ ಪ್ಯಾಂಟ್ಗೆ ಹೀಗೆ. ನಾವು ಫಾರ್ sulfur it not matter. For sulfur it not matter. Fine. For syphilinum, for arsenicum, all it will matter. Forget about ಯಾರಾಗ ಒಡ್ಸೋದು. ಇವ್ರು ಎಷ್ಟು ಉಜ್ಜಿದ್ರು they will not feel happy. But sulfur will not matter. ಊಟ ಮಾಡ್ದ, ಒಡ್ಸ್ಕೊಂಡ, ಆಯ್ತು. ನಿನಗೋಡ್ಸದ್ನ, ನನಗೋಡ್ಸದ್ನ, ಯಾರು ಓಡಿಸ್ದೆ, ಒಡ್ಸದ್ನ. See, many times you should be happy. Sulfur at least ಒಡ್ಸ್ದ. ಸಲ್ಫರ್ ಹೊರಸ್ದ ಗುರು, ಸಲ್ಫರ್ ಹೊರಸ್ದ, ಅವ್ನು ಹೊರ್ಸೋದೇ ಅಲ್ಲ. We had a patient recently, like, you know, a lady who had all on her ಚುಡಿದಾರ್, ಏನೇನು ತಿಂದಿರ್ಲಿ ಎಲ್ಲ ಬಿದ್ದಿದ್ದು. Lady, and you know, I don't know, but at least when you come out, no, when you go out, all this matters, no. She's got a very bad back pain, sciatic pains, and in that state, she's not at all bothered how she's looking, what is she wearing and all. What is this rubric? This is how, you know, okay, chalo, despair, good, see, at least third year you are telling despair, you are telling fear of infection. We realized all this after some time. You are not comfortable. Okay. We realized all this after some time. I am happy. In third year you are talking of these words. Good. I see bright future for you, not homeopathy. Homeopathy has got super future. You young homeopaths. Yeah, good despair. More than that, you know, what is the beautiful was that? Good, very good. Indifference. She's not at all bothered how she's looking. Yes, I'm happy. Indifference. Sir, yes, sorry, no blow. Because of this, you know, she's not having any hope. Forget about my dress. But for me, this case is more of indifference. How I am looking, I'm not bothered. 62 or 61-year-old, highly educated bank manager, retired. If it was a coolie, if it was a third class person, some person, it would not matter. Retired, highly qualified, only English is talking. Right? But that is her constitution. That is her constitution. Beautiful indifference. It will not matter how I look. For me, what is more important? No. So, sulfur people are very practical people. ಹೊಟ್ಟೆ ಹಸಿತು, ತಿಂದೆ, ತಿಂದಮೇಲೆ ತೊಳ್ಕೊಬೇಕು, ಒರೆಸ್ಕೋಬೇಕು, ಆಯಿತು, ಒರೆಸ್ದ, and they do. So that is sulfur. And people, you know, who dress all jing-jang, you know, ಕೆಲವರಿರ್ತಾರೆ ಶೈನಿಂಗ್ ಎಲ್ಲ ಡ್ರೆಸ್ಸು, ಇಯರಿಂಗ್ಸು, ಇಲ್ಲ ಹಾಕಿರೋದು, ಟಿಕೆಟ್ ಫೈನ್, jing-jang. See, in few communities it is common. You should be very careful. In few communities it is common. Yesterday we had a lady from Canada who had come. Nim doctor, Sadru, international, Canada, US, UK. No, don't worry. No, I mean, this was a patient who was referred. She has come to India, and this lady, you know, all this big bangles, gold. Fine, ಆರ್ಯೋಳು ಇಷ್ಟು ದಪ್ಪ ಏನದ ಇಯರಿಂಗ್, ಇಷ್ಟು ದಪ್ಪ ಇಯರಿಂಗ್, right? And again here she is wearing something all big. At least what do you realize? Fine. More than that, what else you should think of? What did I tell you? What is more important for you is miasm. Which miasm is this? Which? I don't know, I didn't get it. Sorry. Okay, fine. See, that also could be a situation, no? It could be artificial. Right? See, but given the credentials of this particular female, at least it is not artificial. It could be artificial, correct? See, artificial people will expose it more. Artificial ಹಾಕೊಂಡಿರೋರು ಹೊರಗಡೆ ಹಾಕೊಂಡಿರ್ತಾರೆ. Fine, so that at least you people see and you start questioning. What I want to make you realize here is the miasm is also very important. Psychotic people wear everything big. And whenever I use the word miasm, what you need to remember is anything that is psychotic is fake. Anything that is psychotic is fake. Fake ಅಂದ್ರೆ not umagold. Right? What I am trying to tell you is, fake here means you should be very, very careful when you take the case. When my assistants took the case, कुछ नहीं, कुछ भी नहीं, सब कुछ perfect, सब कुछ perfect, सब कुछ perfect है तो thyroid क्यों, diabetes क्यों, hypertension क्यों? You getting my point? Fine. So your approach to a psychotic patient is very difficult, and it should be different. How they wear, what they wear is also very important, and what you have to realize is, Hyos will wear dress which has got more scope for exposure. What has to be hidden gets exposed. Fine. And don't expect every Hyos patient who comes to your clinic should wear exposing things. Fine. Not necessary. You have to be a little careful. Okay. So, what is it? Why Netramure wants things clean, neat? As for if it is over. See, what is Netramure's mind? Netramure is a very sensitive remedy. Netramure is a very sensitive remedy. Netramure ge yaradru comment madidre, they will not like it. They will not like somebody making fun. Yeah, what this kind of dress you have worn? Or what your house is like this? What your book? What your hair? What your this? Netramure, they are very, very sensitive. They will not like anybody commenting about them. Huh? Reaction is, why give you a reason for you to comment? So I will need. You are getting my point? Netramure will not give scope for you to comment. Okay? So before you comment, meaning they are clean and neat. Or because Netramure would have gone through a lot of trauma, and they have no energy, they have no strength to face further traumas. Okay? So they will not give you an opportunity to comment. Adike Netramure Magalu, Netramure daughter, or Netramure wife, they will not give a scope for the husband to scold. My husband wants this, okay, I will be like this. That kind of a thing. That kind of a situation is what you are in Netra. Okay? So dressing, how they dress, lascivious and obscene, lustful. These are all the sexual symptoms you have in Hyoscyamus. You see this image, they're very obscene. What has to be done in room, it has been done openly. Fine. I mean, it will not matter for them. Okay? So very obscene, very indecent. Okay? These behaviors is what you see in obscene behaviors. See, not only the behavior, not only dressing, I also told you the talk in Hyoscyamus can be obscene. The singing, we discussed 2 days back. The singing also in Hyoscyamus is all corrupt singing, double meaning, right? That kind of singing. Okay? And these are a few more things which will again talk of the sexuality of Hyoscyamus. Amative, the sexual love, amorous. Amorous can also be thought of as a broader rubric when you talk of people who are flirtatious. What do you understand by flirtatious? People who are flirts. Not necessarily boys, it can also be girls. She is such a big flirt. He is such a big flirt. Flirts. Flirts. Who are flirts? Don't again give names, take names. I am afraid when I ask something, your energy, your enthusiasm, you'll come out with names. More than names, the understanding is important. And I am happy you have understood it practically. But then, you know, in class, if they are net, I mean, they should not get offended. Or if he is Hyoscyamus, he will feel happy. Oh, see, everybody is taking my name. First of all, he will not have any shame. So he or she will feel very happy. So don't worry. See, what flirts? People who keep, you use this word very often, no? Who keep flirting. And the relationship there is very superficial. The relationship is only limited to the physical level, nothing deep. And they are the kind of people who will not settle with one female or one male. They keep playing. Fine? Flirts. Okay? Chalo. So, amorous, amative, okay? The arousal of feeling of sexual desire, right? Sexual love antivi. Okay. Now this is what I was trying to tell you, that this is also a very important remedy for nymphomania. Nymphomania or excess sexual desire in Hyos is mainly during menses. During menses. It's a very discomfortable situation for a female, but Hyos enjoy sex during that period, or they want sex during that period. The other remedies which are nymphomaniacs.
Murex.
Platina, very good.
Murex.
Murex, good. Murex also has excess sexual desire. Veratramel, yes. Camphora, good. Graphites, carboids, carbons, better remedies. Jora, correct. Apis mellifica, the queen bee, is again known for its sexuality. Okay. Apis mellifica, we also have rare remedies like oregano. Just have that in your mind. Oregano. Okay. Nymphomania, apis. See, this is also another situation which I explained few minutes back, that exhibitionism. They're very comfortable exhibiting what should not be exhibited. Exhibitionism. Okay. See, another very important thing we miss here is shamelessness in Hyos. We discussed in the last class. It also can apply to masturbating in public. You get this point? Okay, masturbating in public. The only remedy we have in our materia medica, masturbation in public, is Hyoscyamus. Okay. See, this was the sexual aspect of Hyoscyamus, that they are nymphomaniacs, they have increased sexual desire, and they are perverts, lasciviousness, obscene, lust, and shameless. These were few words that describe the sexuality of Hyoscyamus. The next area we'll be focusing will be the emotional part of Hyos. They have strong emotions. Emotions are very strong in Hyos. Okay. So what are those emotional symptoms that you have in Hyoscyamus? You know, good. There is jealousy. Huh? There is suspiciousness. Beautiful, correct.
Fear.
Jealousy, suspiciousness. Yes, there is also fear. I'm talking of common emotions. Yeah, anger. Yes, anger.
Violent.
Yeah, they being very violent, huh? Vicious, violent, malicious. There are few words that will come up. See, now what I want you to understand is emotions tumba strong irutte Hyos. Okay, and what you also see in Hyos is they are highly talkative people. They are highly loquacious. People who talk, very talkative. Okay, loquacity is what we discussed in Stomonium. Yes or no? Which are the other loquacious remedies? Lachesis. Then, huh? Pteridian. Correct? Here, Andre. Sulfur, very good. Sulfur. Yes, good. Phosphorus. I'm happy. Stramonium, phosphorus, sulfur, lachesis. Huh? Ophidius. Generally Ophidius. Okay. Sulfur. Don't forget sulfur. Sulfur is a person who can instantly connect with anybody. Anybody, any damn person. Any damn person. They can instantly connect. A kid, elderly person, any person, somebody sitting next to you in the bus, yeah, they get that link, they get that connection, they get connected very easily. Sulfur. I can mix with anybody, sir. Small person to old person, any person I can mix. It's more of sulfur quality. Lachesis, yes. Phosphorus. But phosphorus, they know speciality. Phosphorus, they know speciality. Good, lot of company. Now, we had a beautiful case here. You can just check with Supraj, he's got the video of that particular case. When you had clinicals, we were having a look at that case. A small boy, I don't know even if you have seen. he's got left-sided hemiplegia. Okay. Can you describe that particular boy to me? Have you seen that boy? Yes? If you have seen. When I said, have you seen the boy? You said yes. When I said, describe the boy, sir, no sir. Oh, that boy, no sir, you are not saying. Yeah. How was that boy? Yeah, you can just check with the Supraj. He's taken a small video. And that is a boy, First thing, when I entered, generally doctors, people are very scary. And this guy just came, he hugged me, he shook his hand, and this instant connect it's not sulfur. That's more of phosphorus. Okay? He would, when we are taking his case also, he would just come, hold one of our legs, hug tight 2 minutes, and then he will run off. Though he's got left side hemiplegia, calling it for he would run up and down, and again 2 minutes, 3 minutes he would come, pull one of those boys or girls thing, and then just run off. Phosphorus people are people who wants to be magnetized. Okay? They will suck that energy from you and they run away. You getting my point? They want to be hugged, they want to you to cuddle them, caress them and all those things. They just come hug. And phosphorus is again very instant. Very instant. What is phosphorus like? It's like RS3. It's like water. It's like water, diffusion. It can get into any container. That's phosphorus. So this boy, who could just come, gel with any person, play with them, hug them, fine, and just run away. That's more of phosphorus. So loquacity, here, they keep changing from one topic to another topic, and again, like many remedies, phosphorus talk content is more sexual. Okay? Few of you might be comfortable. Who will be comfortable? Again, don't raise your hands and don't give names. See, one thing you'll have to remember, it's a beautiful clue I'm trying to give, but don't use this clue too deliberately in your clinic. What is that proverb, English proverb? Birds are the same feather, huh?
Flock.
Birds of
Same flock.
same feather flock together. What I want you to understand is, a sulfur will have sulfur friends. A varad will have varad friends. You are getting my point, yes or no? Varatram, they will be comfortable with Varatram kind of people. There are 100 people here. Are you comfortable with all the 100? You might say yes. Then it could be phosphorus, then it could be sulfur, something different. But then there are few people who are comfortable with only few. Why are you comfortable? Sir, like-minded. Like-minded. You getting my point? Fine. So that like-minded can also help you in understanding the constitution. But I don't want you to take this very seriously. Then tomorrow some person comes, you give him Varat, and he says, sir, I referred this friend of mine. Oh, VKs are told in 3rd year, when somebody is Varatram, his friend also will be Varatram. Homeopathy is not so easy. But somewhere it can give you a small clue. But don't prescribe by that. It's the worst homeopathy that will be taught to you. Okay? So get back. Loquacious. And see, this is also a beautiful thing which many of us do. And what do we do is we keep gossiping in the corner of the walls when there is no class, or sometimes even in class, we keep gossiping. Fine. So gossiping. Hyos is the #1 remedy who can gossip. I hope you understand gossiping. Hyos, lachesis, varats, stramonium, few remedies for gossiping. Very cheerful, very smiling, very jovial. Hyos, okay? And this is also very important. Somebody was using the word jealousy. Before jealousy, what you also have to understand is, Hyos is also a remedy which comes under envy. Now what is envy? How is envy different from jealousy? Envy andrena. Somebody has something, okay, and you feel bad about it, like yeah, they have and I don't have. It could be anything. It could be a long hair, fine. It could be a beautiful dress, or it could be a car, a bike, whatever you have, and I don't have, and I feel envy. I feel envy, and envy, as I understand, is more constructive. Right? My neighbor has got a car. I envy my neighbor. So what do? I get a bigger car. Okay? Fine? Now what happens in jealousy? Jealousy, you will have some kind of thing happening. I shared an example, like for example, I have a car and you don't have a car, so what do? You take something and you scratch. You scratch, right? You scratch. I don't have and this bugger has, so let me spoil it. And when I go get it repaired, you feel happy. See, 10,000 rupees. And you feel happy. That's more of jealousy. We talk of jealousy, but again a remedy for envy. Which are the other remedies? Envy. First. Apis has got more of jealousy. We'll also talk of jealousy and apis a little later. But Naxvamika, very ambitious somebody. But Naxvamika is a person who will work hard. You are getting first rank. Yeah, I'll also get. Fine. Okay. But I always talk of this movie, A Student of the Year. I would have shared this. Okay, if you watch that movie and you see a lot of jealous situations there, envious situations there. Okay. So envy, and again we saw this image in the last class. What does this tell us about?
Jealous.
That particular lady in between is jealous. Okay, jealousy. Jealousy is a very strong emotion which is there in Hyoscyamus. Quickly, other jealous remedies. Apis. What is apis? Apis jealousy. Somebody first year remedy. Also done for RS4 in second year. Apis first. Apis. Again, the queen bee is the most jealous creature on earth. The bee. Okay, and apis is also a remedy in which you have jealousy. Jealousy more in women and jealousy more in young widows is apis magnifica. Jealousy more in young widows. Apis. Okay. So other remedies, again Ophidius, lachesis. But the jealousy in Hyos is very, very characteristic. Okay. Now what you see here is jealousy going to the extent of revenge. Okay. And jealousy which mainly comes from disappointment in love. Jealousy. When you talk of ailments from disappointment in love, you have Hyos. And what Hyos does, I told you, they go to the extent of taking revenge. You refuse me. Fine? And they can harm her, they can trouble her. So jealousy going to the extent of revenge is Hyoscyamus. Okay? We have discussed this disappointment in love, to the extent of harming, biting, okay? Anger, extreme anger, kicking, all those behavioral problems, shouting. Jealousy with rage, wants to take revenge, desire to kill, which you saw there, is all what you have in Hyoscyamus. Okay? This is also religious, though out of three remedies in which religiousness is more prominent? No, out of stramonium, belladonna and Hyoscyamus. Stramonium is more religious. Okay? Though you also have religiousness in Hyos and belladonna, Hyos is religious. It contains, see the tragedy in Hyos. So much sex there. See it's not visible here, but what I want to try to tell you is, see this, it contains a degree of obscenity. See, to the extent of obscenity you have in Hyos, that they imagine of having sex even with God. You getting my point? Yeah? Okay. So these are all pathological things. God is something supreme, and you are not even sparing him or her. Fine? Okay? So, if you get such patients who are so corrupt to that extent, please don't forget Hyoscyamus. Hyos. Okay? The question is, how many of them will come and tell you? That's the question. Yeah. But not necessarily everybody you should ask this question. But then, yeah. See, it's very important. The negative emotions, nobody will talk. That same lady I was trying to tell you yesterday, assistant took the case and we had 3 more assistants in my chamber. And when I asked her, I told her, see, you are from Canada. Right? I am here. You are giving case, you give case correctly. Otherwise I can't help you. Because next month you are flying back. And I can't give you some wrong remedy. I see the beautiful case, part of case taking, when you don't get the case, you threaten. At least, threaten in the sense like, no, I can't help you. Fine, you tell me correctly, I'll give you the correct medicine. Otherwise, it's not going to be possible. Then she started looking at my assistants. What is the clue she is giving me? Boss, I'll tell you what you want, but I don't want these people. And chalo, fair enough. Okay, so we sent them out and then 40 minutes she spoke, 3 pages we filled, and then it was a beautiful remedy, it was a different remedy. You're getting my point? So how to take out the negative things are very, very important. And especially I'm trying to tell you, when you got a lady with all these big things, and big things also applies to her physique. Big, everything big, when she comes in front of you, and any damn thing she is talking to you, you have to take it with a pinch of salt. I am very good. You, don't tell in front of her. But at least that's what you should tell in your mind. How can she be? Fine. Then you can start interrogating. But what I am trying to tell you is, any psychotic person telling anything, please don't take it. Yenida? Pungi ಓದ್ಬಿಟ್ಟು ಕಿವಿಯೊಳಗೆ ದಾಸವಾಳ ಚೆಂಡು ಮಲ್ಲಿಗೆ ನಿಮ್ಮ ಕೆಪಾಸಿಟಿ ನೀವು ಎಷ್ಟು ದೊಡ್ಡ ಹೂ ಇಟ್ಸ್ಕೊಡ್ತೀರೋ ಅಷ್ಟು ದೊಡ್ಡದು ಇರ್ತಾಳೆ. ಚೆಂಡು ಹೂವಿಂದ ಹಿಡಿದು ಮಲ್ಲಿಗೆ ಹೂವರೆಗೂ ಇರ್ತಾಳೆ. Fine. So what I am trying to tell you is, you should be very, very careful. Whatever she tells, yeah, take down. Yes. Many times, the best part of case taking is you praise, very good. How can you do all these things? Very difficult to get a lady like you. You know, she is doing it with a different reason. You also know you are telling it with a different reason. But then, when you start, praising them, then all the reality will come. Very difficult to find a lady like you. In India, we don't get. Canada is very lucky to have you. Oh, that's it. And once you praise and once you take them to a different level, then she'll tell you why I went to a different level. You get my point? So it's a beautiful thing, case taking, but then it needs a lot of patience, a lot of time. And I was reading one of my teacher's notes yesterday. This is what, again, as a third year student, you should learn. Case taking is not about questioning. Case taking is not about questioning. Case taking is developing a bond between patient and you. I hope you understand the seriousness of this statement. What generally we take, how is your mind? Kopa baratta? Illa. Bhaya agatta? Illa. Right? ನೀವೆಲ್ಲ ಜೊತೆ ಮಿಕ್ಸ್ ಆಗ್ತೀರಾ? ಆಗ್ತೀನಿ. ವೆರಿ ಗುಡ್. ಕೋಆಪರೇಟಿವ್. ಫೈನ್. ಏನು ಕೋಆಪರೇಟ್ ಮಾಡೋದಮ್ಮ ನಿಮ್ಮ ಜೊತೆ? ಕೋಆಪರೇಟಿವ್. ಎಲ್ಲರೂ ಅದೆಲ್ಲ ಕೇಸ್ ಶೀಟಲ್ಲಿ ಬರೆಯೋದು. ವೆರಿ ಕೋಆಪರೇಟಿವ್. ಸಿ ಅಷ್ಟೇ ನಿಮ್ಗೆ ಹೇಳ್ಕೊಟ್ಟಿರೋದಾ? ಡೋಂಟ್ ವರಿ. ಐ ನಾಟ್ ಟಾಕ್ ಆಫ್ ದಟ್. But what I am trying to tell you here is, see, why should she tell you all her inner things, all her, concealed things? Why should she tell you? Who are you? Why should she tell you? You should create that atmosphere wherein she feels comfortable sharing all her inner things to you. You getting my point? Positive vibes, I am anku barbeku. You yaake helbeku? Anyway, you will not give a right remedy, all that is fine, but then again, she should feel comfortable. Right? Our comfort zone is tarodu, that is your capacity. Not only asking questions, name, age, sex, ganda, henna, yavanu ಬೇಕಾ. Right? So anyway, you learn with your age, it's not a problem. Okay? So this is what one of your friend was contributing. Hyos is again a remedy which is suspicious. Which is suspicious. Suspicious to the extent, what will Hyos do? Hyos do suspicious, they refuse medicines.
Fear of
They
being
refuse.
poisoned.
They refuse medicines because they have a feeling that they will be poisoned. I have a beautiful case which I saw in Mumbai recently. One of my sir conducts free camps for Hope for Hopeless, and this boy, 24 years old boy, who would not eat anything. Any food, water you take near his mouth, he says, no. Very elderly guy, 24 years old guy. And then while sir was taking the case and all, no, he would put hand in the intern's apron pocket. He took her mobile out, and when she got scared, and then he started smiling, he started enjoying. When sir was taking the case, he was slightly going and pulling her stethoscope, doing some kind of a things, and he was all enjoying. The entire 50 doctors who were there, they were also laughing, enjoying and all those things. But the only problem is when you take food, when you take water, he says, nah. So much that a girl had taken the case, she thought at least now he became close, he will drink something, anything. Max what happened after 45 minutes, he took it. But you want me, then she says, cow, he does not speak. Cow. He says, cow, na. History itkonda bisakta, fine. And there sir had given this remedy, Hyoscyamus. Okay. What is that you have in Hyoscyamus is delusion as if you are poisoned. I don't know how much you understand, but I wanted to share this case. It's a beautiful interpretation by my sir. Okay. And what is this? What is the thought process that is happening in his mind? He feels he has been poisoned, and so he is rejecting. And then you have got all other symptoms of Hyoscyamus. What were the other symptoms? Very mischievous, and he enjoyed when he was doing everything, antics plays.
Attention.
Everything, attention seeking, everything will fit in later. But then what was that rubric he entered through was delusion, he has been poisoned. Food is been poisoned, something like that, and he would reject everything. Hyos. After 3 months, we'll go back to Mumbai and I'll share the follow-up. But at least for you, it's a very good learning experience. Okay? So here again, they refuse medicines. Which are the other remedies? Very good, I'm happy. Restaurants. One more. Whenever I look at you, it means Ophidia. Because he was talking of Ophidia's whole of today. Lachesis. Lachesis again is a remedy which refuses medicines because they feel it is they are trying to poison us. Okay. Quickly, other remedies. You got a list of remedies.
Baptisia.
Yeah. No. Baptisia has no fear that she or he has been poisoned. What made you think of Baptisia?
The delirious condition, body being
Yeah, correct. See, Baptisia has got a delirious condition. They feel parts are separated, but then they will not refuse medicines. Okay, don't worry. I have given you the list of remedies which will refuse medicines, which are suspicious. Okay, and the last part in stramonium is the fear. They got strong fears: fear of being alone, fear of dog. Okay, fear of animals in general. What happened? Dogs. Dog looks very, you don't feel afraid looking at the dog, but you don't like it. My intention of putting this is even such kind of dogs, Hyos is afraid. Okay. And I know the Papa answer. I don't know Hyos. Fear of people, fear of ghosts, fear of being poisoned. See, this is in a different sense. Okay? It's in a different level, different miasm. Okay? Fear of, see what your friend was trying to ask me is, sir, you said they are attention seeking, and why do they have fear of people? Okay, see, we can give you two explanations here. One is the miasm. Okay? In different miasmatic state, the mind can vary. Or we have got a new concept that Hyos, you can have different Hyos types. Okay? One type who is having attention seeking, the other Hyos type might have fear of people. Okay? So both can happen, is what you have to understand. Okay? See, fear of water is also very characteristic. And what is this? Fear of being poisoned, which we saw. Fear of being poisoned. Okay? Very angry remedy, we saw that highly quarrelsome. Okay? Quarrelsome associated with jealousy. Okay. So this is all related to anger, rage. If you just see this, yeah, it's all there. If you just see this, like very angry remedy, rage, the highest degree of anger, which mainly comes from disappointment in love, and they can start taking revenge. Okay, troubling the girl or troubling the other person, they go mad. Lot of serious pathology happens in rage, which comes from disappointed love. You try to correlate this text with the previous slides that you have seen. Violent rage, to the extent he has to be chained. Which was the other remedy? Someone Marathon. Okay, and he tries to kill people, and breaking, very destructive, hitting, being abusive, cursing. Okay, lot of delirium. So delirium again is more of erotic. What is erotic?
Happy.
So erotic is more to do with sex, sexual delirium, or very destructive delirium, violent delirium. They talk of dead. Okay, they see animals. See, Hyoscyamus, you got 1090 symptoms on the mind. Okay, I can't tell all those for a third year UG student. What I've tried to do here is I've tried to give you a gist of Hyos, which you should not miss in your clinic tomorrow. One is that sexual part we saw, and other is the strong emotions they have, and how does a Hyos person react emotionally, in terms of anger, in terms of rage, in terms of talking, in terms of fear, in terms of envy, in terms of jealousy. Okay, how do they react is very important. Hyos is also a remedy which has suicidal thoughts. Suicidal thoughts which can also come from disappointment in love, and suicide by drowning, suicide from falling from a building, or suicide with knife. This is the climax which you have to understand. More probably in your PG classes, or as you start practicing, you can keep this foundation and you can build on these things. Okay. Before we close, Hyos, any questions? Boys and girls? Yes. See, strong in emotions and emotionally strong. Good question, sit down. See, what your friend wants to ask here is, sir, you said Hyos is emotionally very strong is what you told. Then how can they go into fear is what your friend is trying to ask. But what I want you to understand is, the emotions ideyalla, the fear, anger, they are very strong. Strong andre, they are exhibited in a very higher degree is what you have to understand. I am not trying to tell you emotionally they are strong. Ataralla. ಆ ಎಮೋಷನ್ಸು ಇಲ್ಲಿ ತುಂಬ ಸ್ಟ್ರಾಂಗ್ ಆಗಿ ಕಾಣಿಸ್ಕೊಳತ್ತೆ ಅಂತ. ಕ್ಲಿಯರಾ? ಗುಡ್ ಕ್ವಶನ್. I hope this is clear for all of you. I am not trying to tell you that they are emotionally very strong. Fine? Emotions are strong. I hope you understand the difference. Okay? Good question. Any more questions? No questions? Okay, so we will stop there. So thank you. So, Hyos Ayato, and probably you have your vacations. So probably once you come back, second term,